Welcome to Brain Injury 101. Today we're going to look at a general overview of brain injury. First things first, we're going to look at the acquired brain injury, and that's what we'll be dealing with for the most part with our clients. An acquired brain injury is an injury to the brain that isn't hereditary, congenital, or induced by birth trauma. This is a change in neuronal activity that changes the brain's overall ability to function. With acquired brain injury, we're going to look at two subsets. The first subset is a non-traumatic brain injury, or NTBI. This is often mixed up and called acquired brain injury, but this is a brain injury that is not due to blunt force trauma, and it causes damage due to more internal factors. The other subset is a traumatic brain injury. This is a brain injury due to blunt force trauma. Alteration in brain function and functionality itself is strictly due to that blunt force. These impacts can also be lead to inertial forces, and we'll continue to talk about that as we go through. Now let's take a look at some examples of non-traumatic brain injuries. These can be things like stroke, anoxic or hypoxic injuries, poisoning, a virus, or even a tumor. Going back and looking at stroke, there's two main types of stroke. You have an ischemic stroke or a hemorrhagic stroke. An ischemic stroke is a blockage somewhere in the body that causes a lack of oxygen to the brain. A hemorrhagic stroke is a bleed somewhere that causes excess blood in the brain. Another thing to really take a look at is these anoxic brain injuries, which we're seeing a little bit more of now, especially with younger individuals. These anoxic brain injuries tend to be due to drug overdoses, and they cause a whole world of deficits, looking mainly toward the midbrain and then working its way outward. Whereas with traumatic brain injuries, the damage tends to be focused more toward the cortex, and then it works its way in. So that can transition us to looking at examples of traumatic brain injury. These can be due to a fall, a motor vehicle accident, maybe struck by an object, could be sports injuries, or even a military type injury like an explosion from an IED. When we look at impact and we look at traumatic brain injury in general, we want to look at the brain first. The brain is a very complex machine made up of 86 billion neurons and 100 trillion synaptic connections. The brain itself is kind of a congealed oatmeal jello-y mush, except when it's in our skull. If you were to place your brain out on a table, it would probably continue to expand and spread out onto the table. So when we look at blunt force trauma and we look at the coup contra coup effect, that means that while sitting in this cerebral spinal fluid inside of our skull, the brain has an initial impact, then travels backward, makes a second impact, and then back forward again, making a third impact. This can cause a lot of damage in multiple different areas of the cortex. But another thing we really need to look at with traumatic brain injury is the inertial forces causing things like axonal shearing and diffused axonal injuries. And this means that all of those 86 billion neurons or those 100 trillion synaptic connections get moved around and jumbled, and they're unable to communicate as effectively as they did before. So to conclude Brain Injury 101, let's take a look at some common traumatic brain injury symptoms. First, we'll take a look at the physical symptoms. These are things like headache, nausea or vomiting, fatigue or drowsiness, problems with speech, dizziness or loss of balance, loss of consciousness from several minutes to several hours, persistent headache or headache that worsens, repeated vomiting or nausea, convulsions or seizures, dilation of one or both pupils of the eyes, clear fluids draining from the nose or ears, the inability to awaken from sleep, weakness or numbness in the fingers and toes, and a loss of coordination. We can also look at cognitive, behavioral, or mental symptoms. This is a loss of consciousness for a few seconds to a few minutes, a state of being dazed, confused, or disoriented, memory or concentration issues, mood changes, feeling depressed or anxious, difficulty sleeping, sleeping more than usual, profound confusion, agitation, combativeness, or other unusual behavior, slurred speech, or coma and other disorders of consciousness. And now lastly, we're going to look at some sensory symptoms. These could be things like blurred vision, ringing in the ears, bad taste in the mouth, changes in the ability to smell or taste, sensitivity to light or sound, visuospatial processing issues, and visual disturbances, things like field cuts.